Right. So as I said, this first session is going to be an overview of what drug addiction or drug dependence is, what is disorder about using various substances. To clarify once again, Atul Ambekar is name of the person who is talking to you, not name of the gentleman whose picture is here. Though on some weekends people claim that I resemble this person. I don't know why. Right. So what basically this particular talk is and what it is not. It's definitely not a pravachan or a preaching. We are not going to take any moralistic stand on this. But what we are going to discuss is we are going to understand some facts and myths about substance use, and which will enable all of us as well as our clients, our friends, the people whom we serve, make informed choices about their own lives, about their own habits. So we are going to discuss very briefly about alcohol as well as drugs. We are going to go into slightly historical account of India's experience and interest with drugs, and we try to understand what is disorder about using drugs. Various types of drugs, as we all know. Let's take the first one, the prototype drug, alcohol. We are all quite familiar with this particular substance, and there are a wide variety of alcoholic beverages available, as we all know. What do you think is the most favorite beverage of India? Alcoholic beverage? Beer is most favorite? Country liquor is most favorite in India? No, I'm sure you are not talking about your personal choice. Right. Your assessment of what Indians like. So basically, all these beverages, whether they are distilled spirits, which are also known as Indian-made foreign liquor, Angrezi sharab, like whiskey, rum, vodka or gin, beer, wines, all of them have what's common among all of them is all of them are alcoholic beverages, and they differ in terms of the concentration of ethyl alcohol in them. They differ in terms of the raw material or substrate used to produce them. They differ in the manner of their production, as well as some additive chemicals which are added to them to grant them a distinct flavor, a distinct taste, distinct aroma, and perhaps for many people a distinct effect as well. People would claim that a whiskey gives you a different kind of intoxication as opposed to rum. It happens because of some congeners or some other additive chemicals which are added to alcohol. And what happens after you drink? Well, we'll come to that. So, many people have this kind of belief as well. कि मैं तो ज़्यादा पीता नहीं हूँ, मैं तो खाली beer पीता हूँ. People have this tendency to think that perhaps low alcohol content drinks, if you consume them, they are not as harmful as opposed to consuming high alcohol content drinks. What matters is the total amount you have gulped down. So which means basically one standard drink is 10 ml of absolute alcohol, about half a bottle of regular beer, about 1/4 bottle of strong beer. Strong beer is almost double in alcohol content. One peg of spirits and then one glass of wine. So people who claim that मैंने सिर्फ 2 beer पिया है, ज़्यादा नहीं पिया है, are actually lying. It's about a quarter of whiskey which they have gulped down. And what happens when people drink? It goes into their stomach. From there it's metabolized in liver, goes into the brain, and then it acts. And then what happens? Many of us may have seen this cartoon. Before 6 beers, someone appears like this, and then after 6 beers, things start looking very beautiful, very pretty to us. And all of this depends on what? It depends on actually the blood alcohol concentration. So what matters is not the amount only which you have drank. What matters is what is the concentration of alcohol in your blood. And that depends on what? The speed with which you are drinking, the kind of beverage which you were drinking, and whether you were eating something along with it or not. For instance, if you drink carbonated beverages like beer, or you mix your whiskey with Pepsi or soda, is going to be absorbed faster, and you are going to be intoxicated faster in such cases. People mix vodka with fruit juices of various kinds. Fruit juices have sugar. They increase the absorption of alcohol, and then it's going to hit you harder. If you dilute alcohol with just plain water, it's probably going to be absorbed slower, and it's going to have a lesser sort of intensity of intoxication after the time which you spend. If you eat something along with it, it's going to be absorbed slower. It's going to hit you slightly less. And there are, of course, many genetic variations as well. Many of us are aware of the South Asian or East Asian pattern of ALDH enzyme and how the metabolism is different. And these are the effects. Again, all of this is present in books. We are not going to waste too much time in that. But as we see, as the blood alcohol concentration goes on increasing, so are the brain depressant effects of alcohol. And hence, interestingly, on smaller doses, alcohol paradoxically appears to be acting as a stimulant. Why? If alcohol is brain depressant, it should cause brain depression all along. But in smaller amount, when you drink, your blood alcohol concentration is not very high. It starts depressing some of your brain functions. And which are the brain functions which it depresses? The brain functions which are inhibitory in nature. Those brain functions which keep our behavior always in check. I always give this example to people कि हमारा सारा behavior जो होता है उसके ऊपर एक तरह से लगाम लगी हुई रहती है, कंट्रोल सा रहता है. So when we are talking to our friends, we behave in a certain manner. When we are talking to our elders, we behave in a different manner. So ये जो लगाम कसी हुई रहती है, brain के सारे functions depress होते हैं. The first thing which gets depressed after drinking is this लगाम, this control. The control is lost. You start feeling disinhibited. You start having some kind of sense of boisterousness. हिम्मत ज़्यादा आ जाती है, साहस ज़्यादा आ जाता है. And then you start talking more. You start expressing those things which otherwise you would have kept in check. And gradually, when it increases the blood alcohol concentration, your other brain functions start also getting depressed. You start developing incoordination, etc. Finally, you may go into amnesia, coma, or even death. So, how much drinking will cause an increase in your blood alcohol concentration? There are lots of variations in terms of the beverage, the genetic variations, the food, the setting, your own mental setup before you are drinking. But in general, rule of thumb is that 2 standard drinks in the first hour are going to increase your blood alcohol concentration to about 0.05%. And thereafter, if you keep drinking 1 standard drink per hour, that will maintain that level. Of course, most people who drink, they do not drink so slowly. People tend to gulp down as much amount as possible in the shortest possible time. That's one of the difference between our pattern of drinking and Western pattern of drinking. I'm coming to that shortly. And this is the legal limit for drinking and driving in India. In other words, our legal limit for drinking and driving is very, very strict. Even if people have had just 1 stiff drink, after about then 1 hour, if they are driving, they will be committing an illegal act, a crime. But the problem, as we all know in our country, is not the laws, it's the implementation. So we don't really check people's blood alcohol levels so often, and hence people get away. And hence the best idea for drunk people is not to drive, just to cross the roads, if not on 2 feet, at least on 4 limbs, but to remain safe. So that was about alcohol. We come to the next category now, opioids. What does the name indicate? Opioids? Products which come from opium. Is that the answer? Someone saying no. Who is saying no? क्या है opioids मतलब? If not from opium मतलब? As the name indicates, opioid मतलब opium जैसा, like opium. So all those products which act on our brain like opium would do are opioids. Whether they are coming from the opium plant itself or they are synthetic, manufactured in laboratories and factories. But if they are acting like opioids would do, they are opioids. The prototype opioid drug is morphine, derived from opium, which comes from this plant, poppy plant. Just as a side, the fruit of the plant looks like this matka. When at a particular stage, when it gets ripe, people put just a small incision on it, and exudate, a milky white exudate comes out of it, which when dries up, it's scraped up from it. That becomes raw opium, from where people extract various kinds of medicines out of them. Morphine is the prototype. There are other drugs which are manufactured, including heroin, which is manufactured from opium poppy plant itself. Which country is the largest producer of opium in the world? Afghanistan, illegal producer. Which country is the largest legal producer of opium in the world? Largest legal producer of opium in the world? India, absolutely right. So we have been one of the largest legal producers of opium. In fact, we act as practically the morphine factory for the entire world. But the sad part is most of the morphine, most of the opioids which we produce so proudly gets exported. And the rich patients of USA or Western Europe, they are the ones, they are using morphine produced from us. And our cancer patients or people who need morphine actually, they don't get as much of supply because of tight regulations. So that's the policy game.